Hi there, my name is Russ. I'm going to be your nurse practitioner student today. How are you doing?
I'm doing very well, thank you.
And what is your name?
Lynn Urban,
And Lynn, what is your date of birth?
8/28 of 1978.
So that makes you how old?
46 years.
And what do you do for a living?
I'm an astronaut,
Oh, very nice. And what gender do you identify as?
female,
Can you tell me who the President of the United States is?
Donald Trump,
And do you know what today is?
Saturday.
Patient is alert and oriented. Patient is well groomed. No obvious signs of deformities. Patient is calm. No distress noted. So today, Lynn, I'm going to be doing a head-to-toe assessment on you, if that's okay.
Oh, wonderful.
At any time in this exam you become too hot, too cold, you let me know. We'll make some changes and get things taken care of for you. Okay?
Okay.
And did you come in today for a specific complaint?
I've had a very sore throat for the last 3 days.
For 3 days? All right, we'll
Yes.
make sure we get that addressed. I'm going to go ahead and wash my hands real quick.
Okay.
All right, Lynn, the first thing I'd like to do is take a look at your hands.
Oh, wonderful.
Nail beds are pink. Cap refill is less than 3 seconds. Skin turgor is brisk. If you could go ahead and make a little fist for me like that. All right, the test for clubbing is negative. You have a little window there, which is normal. No lesions or rashes noted. Skin is warm, dry, and smooth. Hair is evenly distributed. All right, you can put your arms down. And I'm going to take a look at your head here. Patient is normocephalic. And if you could smile, frown, puff your cheeks out, stick your tongue out. Cranial nerve numbers 7 and 12 are intact. Okay, and I'm just gonna feel through your head here. No nodules or masses noted. Hair is evenly distributed. No signs of alopecia. Look straight ahead for me. All right. I'm going to just go through and fill your lymph nodes here. Occipital, post-auricular, pre-auricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, deep cervical. If you could shrug your shoulders for me. Good, supraclavicular. And bring your arms out. Axillary, epitrochlear, good. No lymph nodes palpated, which is normal. That's good. And I'm going to go ahead and look. Trachea is midline. No nodules or masses noted. Any pain or tenderness in there?
No, not a bit.
If you could swallow for me. Good. No nodules or masses. The right lobe is slightly larger than the left lobe. Good. No bruise noted in the temporal artery. Eyebrows are symmetrical. The eyelashes are curving outward, which is normal. Go ahead and feel your eyes here. Any pain or tenderness in there?
No, not a bit.
Good. No swelling or edema noted to the eyes. Conjunctiva is pink and clear. sclera is white. Cornea is clear and flat. And the irises are multi-pigmented, which is normal. All right, I'm gonna have you stare at my nose here. Corneal light reflex is positive, which is the Hirschberg test. Again, stare at the bridge of my nose. Good. That's the cover-uncover test. I want you to follow my finger. We're going to go through the 6 cardinal fields of gaze. Good. No nystagmus noted. That was to test cranial nerves 3, 4, and 6. And I want to have you cover your left eye. And if you can tell me when my fingers come into your view.
Now.
Again.
Now.
And again.
Now.
Good. And cover your other eye.
Now. Now. Now.
Good. That was the confrontation test to test for your peripheral vision. The red reflex is noted bilaterally. Optic disc is yellow with well-differentiated margins. No hemorrhages noted. And the optic disc is yellow with well-differentiated margins. No hemorrhaging noted. You could go ahead and look at that chart on the wall for me and
Okay.
read the 5th line down.
PMHFD.
Good. Patient has 20/20 vision, which is testing for cranial nerve number 2, which is intact. Pupils are equal, round, reactive to light. They constrict both concentrally and directly. I want you to look at a spot on the wall and then bring into the bridge of my nose. Good. Pupils also accommodate. Go ahead and look at your ears. No lesions or masses. The ears are symmetrical. They are both of equal size. Any pain or tenderness in there?
No.
No? Okay. I'm going to go ahead and take a look into your ear.
Okay.
The ear canal is pink. Tympanic membrane is pearly gray with the right reflex at 6 o'clock. No cerumen noted. Again, ear canal is pink. Tympanic membrane is pearly gray with a light reflex at 5 o'clock. I'm going to do a few tests to test your hearing.
Okay.
If you could repeat.
7, 4, 3. Bird, ball, cat.
Good. Pass the whisper test. If you could tell me if you hear that equally in both ears.
I do.
Good. That's the Weber test. And tell me when you can't hear.
Now? Now?
Good. That's the Rhine test. Your bone conduction was half as long as air conduction, which is normal. And again.
Now? Now?
Good. Again. Air conduction was twice as long as bone conduction, which is normal. Look straight ahead for me and look at your nose. The nose is symmetrical. Both nerves are round and symmetrical as well. I'm just going to feel on your nose a little bit. Any pain or tenderness anywhere in there?
No.
Go ahead and breathe for me. Nerves are patent. Turbinates are pink. Septum is not deviated. Slight moist discharge on the septum. Again, turbinates are pink. Glistening discharge on the septum. We're going to test cranial nerve number 1 here, so I want you to tell me what you smell.
Okay. Coffee.
Good. And I want you to put your finger on your nose, and you're going to meet me. Good. And the other side. Very good. Your lips are symmetrical, they are moist, there's no lesions, there's no cracking. Just stick your tongue on the side of your, there you go. Good, alright, let's check out that sore throat.
Okay.
Alright, how do you stick your tongue out? Good. Uvula is midline, moves up and down. The posterior pharynx is mildly erythematous. Right tonsil is a +2. Alright, go ahead and open your mouth for me again. No dental caries noted. No gingival irritation. If you could stick your tongue on the roof of your mouth for me. Good. And down. And all the way out. Good. And side to side. Good. No lesions. No sores. I'm going to just go ahead and feel through your mouth for anything here. Any soreness or anything?
Not a
in there?
bit.
Good. If you could bite down for me. Grind, good. Any pain or tenderness in the TMJ area?
No.
Good. Alright. Alright, we're gonna move on to doing some range of motion and some strength tests for your upper body.
Okay.
Okay? So the first thing I want you to do is shrug your shoulders again. Good. That's cranial nerve number 11, which is intact. And if you could move your neck from side to side and rotate, good. And hyperextend, extend, good. Any pain or tenderness anywhere in there?
No.
Push against me. Good. And down. Good. And back. Good. Any pain or anything anywhere in there?
No.
All right. If you could stick your hands out for me and open them and close them. Good. And rotate your wrist and flex. Extend. Right. And extend your elbows out and flex. Good. Down. And on your shoulders. Good. And up in front of you. Good. And pull them behind your neck. Good. And on your hips. Good. Any pain or tenderness anywhere in there?
Mm-mm.
Okay. If you could squeeze my hands really tight. Good. Now, hold your hands out. Push against me. And down. Good. Now, I want you to pull. Good. And push. And push out. Down. Good. Any pain or tenderness anywhere in there?
Mm-mm.
All right. We're gonna go ahead and I'm gonna test some reflexes on you, okay?
Okay.
Just let your arm dangle there. Good. This is the triceps reflex. Good. Brachioradialis reflex. Good. Biceps reflex. Switch around there. Good. Patella reflex. Achilles reflex. Levinsky. Just gonna roll these up here. Patient's skin is warm, dry and smooth. No lesions noted, no edema. No pretibial edema. Nail beds are pink. Cap refill is less than 3 seconds. Alright, yeah, I'm gonna lay you back a little bit here.
Okay.
Alright, go ahead and lay back for me. Is that comfortable?
Very
A
much.
little bit more comfortable
Thank
there?
you.
You're welcome. Alright, I'm gonna go ahead and test some pulses.
Okay.
Carotid pulse is a 2+. Brachial pulses are a 2+. Radial pulse is a 2+. Popliteal 2+. Popliteal 2+. Dorsalis pedis 2+. Anterior tibialis is a 2+. Good, all your pulses are very good. Carotid bruit noted. I'm gonna place my hand around your chest, okay, if that's okay. I'm just gonna feel
That's
for
fine.
your no heart, no thrills, heaves. Listen to some heart tones.
Okay.
Aortic, second intercostal right sternal border. Pulmonic, second intercostal left sternal border. Herb's point, third intercostal left sternal border. Tricuspid, fourth intercostal left sternal border. Mitral, fifth intercostal midclavicular. And we're going to listen to all those points again with the bell.
Okay.
Again, aortic, pulmonic, Herb's point, tricuspid, and mitral. Good, everything sounds very good. No clicks, no murmurs, no rubs. Let's see what you got up here. If you could slide to the front of the chair for me a little bit. All right. Patient is in no respiratory distress, no retractions, no accessory muscle use, equal rise and fall of the chest. If you could just take a big deep breath for me. Good. Thoracic expansion is symmetrical bilaterally. You could say the words 99.
99, 99, 99.
Good. Vibrations are felt bilaterally equally, which is normal. I'm going to go ahead and take a listen to you.
Okay.
Big deep breaths. And if you could lift your arms up for me. Good. Any tenderness or anything back there?
No.
CVA tenderness is negative. Again, big deep breaths for me. Breath sounds are clear through all fields. No crackles, no wheezes noted, no adventitious breath sounds. Everything looks really good there. If you could lift your arms up. You can put your arms down, man. Good. Percussion is resonant around all fields, which is normal. A little bit dull around your liver. I'm gonna do a test for ergophony.
Okay.
I'm gonna listen to your back, and every time you feel the stethoscope, if you could say the letters E for me.
E. Okay. E. 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 E.
Okay. Ergophony is negative. All right, are you ready to move on to an abdominal exam?
Absolutely.
All right, I'm gonna lay you all the way back flat.
Okay.
All right, you can go ahead and lay back for me, and I'm gonna give you a little pillow here. Where did my other pillow go? Okay. Abdomen is flat, non-distended. Aortic pulse noted. Abdomen rises and falls with inspiration and expiration. No masses or lesions noted. Umbilicus is round, symmetrical, no lesions noted around the umbilicus. I'm going to take a listen to your abdomen.
Okay.
Vowel sounds noted in all four quadrants. They are normal active. I'm going to listen to your abdomen as well for bruits throughout different arteries.
Okay.
Aortic. Renal, which is superior and lateral to the umbilicus. And iliac, which is inferior and lateral to the umbilicus. No bruits noted. Just gonna feel your femoral pulses right here. Femoral pulses are 2+. No palpable inguinal lymph nodes. Percussion to the abdomen is tympanic, which is normal, a little dull around the liver. I'm going to do what's called a scratch test, which is to try to find the border of your liver.
Okay.
So the normal liver line through here. So you've got a liver border coming in through here. I'm going to go ahead and move on to some palpation of your abdomen, if that's okay.
Okay.
We're going to start with a little bit of light palpation, then we'll go on to a little bit deeper, as long as we don't find any pain or anything, okay?
Okay.
Any pain or tenderness noted?
No.
I didn't feel any nodules or masses. So I'm going to go a little bit deeper with my palpation, okay?
Okay.
Any pain or tenderness there?
No.
All right, patient has no rebound tenderness. If you could lift your head off the bed for me. Good. No diastasis recti noted. No bulges. No hernias. Patient doesn't appear in any distress. No grimaces. All right. I'm gonna sit you back up. Well, why not? I'm gonna do some range of motion exercises now with your lower extremities, okay? Alright. So we're gonna come up and flex and extend and externally rotate, and down. Any pain or tenderness in there?
No.
Flex and extend. Externally rotate, internally rotate. Any pain on that side?
Not a bit.
Good. All right, and so let's move her down, down. Any pain or tenderness anywhere in there?
No.
Okay. We're gonna do several tests that go over some ligaments and your meniscus and your knee, kind of see if you've got any pain or tenderness in those areas. Okay. I'm gonna place my knee on your foot if that's okay.
That's okay.
This is the anterior and posterior drawer test to test for your ACL and PCL. Everything is very stable there. Any pain or tenderness anywhere in there?
Mm-mm.
Okay, good. Alright. And we're gonna do the McMurray test. So I'm gonna bring your neck down. Rotate down. Any pain or tenderness in there?
Mm-mm.
Any pain or tenderness any there?
No.
All right. So I want you to go ahead and flip over to your stomach for me, if that's okay. We're gonna do what's called the Apley's distraction and grind test. I'm gonna place my knee on the back of your thigh, if that's all right.
That's okay.
Okay. And for the distraction, we're gonna test the ligaments by pulling up and internally and externally rotating. And for the grind test, which is for the meniscus, I'm gonna push down and internally and externally rotate. Any pain or tenderness in either of those?
No.
Right, again, I'm gonna place my knee on your thigh again. Rotate. Any pain there?
No.
Alright. Any pain or tenderness there?
No.
All right, Miss Lynn, you can flip back over for me.
Sorry.
And one more test called the Latchman's test. We're just gonna test your ACL stability again, okay?
Okay.
Good. Any pain or anything in there?
Mm-mm.
All right. Everything looks really good. Let's sit you right back up. Maybe. You've been a very good cooperative patient. I appreciate it.
Thank you. That was a wonderful full body assessment.
All right, so we're gonna do a couple of things to end the exam. I'd like you to go ahead and stand up for me.
Okay.
And if you could just turn this way and hang your arms at your side. Good. Patient has excellent muscle tone, firm upper body. Patient's spine is in alignment, no lordosis, no kyphosis, no scoliosis. The arms hang at equal length. And if you could go ahead and just walk across the room for me. Just look at your gait. Very good. And go ahead and walk for me heel to toe. Very nice. And can you walk on your toes? Good. And walk back on your heels. Very good. All right, and if you can come back over for me, I want you to close your eyes and stick your arms out. Make sure you don't fall. This is the Romberg test. Very good. You can put your arms down. And one last little shallow knee bend. Good. Any pain or anything in there?
No.
All right, go ahead and have a seat for me. So today's exam went really well. I didn't see anything that really jumped out at me. The only things that we really saw today was that your throat was a little red. You've got some exudate on that right side of that tonsil. So we'll go ahead and get that treated for you. We'll get a little swab done and make sure to see if you have strep or not, and then we'll kind of go from there. So if you don't mind waiting for that.
Not a bit.
I really want to thank you for your time today. It was really nice to meet you.
Thank you so much. I appreciate it.